Hi, I'm Arshad Khanani with CRI Associates. Here at the angiogenesis meeting, I presented the first-time results of a phase 1 study of THR-687, an integrin antagonist for the treatment of diabetic macular edema. These are my disclosures. As we know, preclinical studies have implicated integrin, especially the RGD integrin receptors, in multiple disease hallmarks of DR and wet AMD. THR-687 is a novel potent RGD integrin antagonist. Inhibition of integrins target multiple processes involved in pathological angiogenesis and vascular leakage. THR-687 has a broad potential in diabetic retinopathy with and without diabetic macular edema, as well as neovascular AMD. One thing to know about integrin is that they work both upstream and downstream of VEGF, hence they have a potential of broader efficacy. Looking at the monkey CNV model, you can see that THR-687 had a potent anti-angiogenic effect. If you look at the grade 4 or 5 lesions, you can see there's a significant reduction of leakage after 2 or 3 injections of THR-687 at multiple doses. If you look at vascular leakage, THR-687 potently inhibits vascular leakage in a diabetic rat HCZ model. As you can see, the inhibition of leakage was measured with fluorescence intensity, and you can see there's significant decrease in leakage by THR-687 compared to the PBS control. THR-687 phase 1 study was an open-label, multi-center, 3+3 dose escalation study. It enrolled 12 subjects across the US. Patients were 18 years or older. They had central involving DME measured with CST of 320 or higher on Heidelberg. Visual acuity was between 62 and 23 letters, and patients had to show a history of response to prior anti-VEGF or corticosteroid in the treated eye, in opinion of the investigator. The primary endpoint was incidence of DLTs between day 0 and day 14. DLTs were measured as intraocular inflammation, 2+ or higher in any compartment, as well as loss of 10 letters or more in BCVA or formation of a macular hole. Secondary outcome measures were incidence of systemic and ocular AEs between day 0 and month 3, and occurrence of lab abnormalities up to the end of the study. The exploratory endpoints included visual acuity and CST in these patients. In this study, there were 3 doses of THR-687, 0.4 milligram, 1 milligram, and 2.5 milligram. Looking at the demographics, most subjects were male and white. The average age was 57.8 years, and there were no relevant differences between the dose groups. Looking at the baseline ocular characteristics in the study eye, there were no relative imbalance between the groups for BCVA, but the CST was lower in the high dose group compared to the other dose groups, as seen here, 499 in the high dose group versus 557 in the low dose and 612 in the middle dose. If you look further into the ocular characteristic, you notice that most subjects had moderate NPDR. Subjects in the high dose group had less severe DR, where all of them had moderate NPDR. All subjects received prior treatment with anti-VEGF. The range was 3 to 19 injections prior to enrolling in the study. Safety is crucial in a phase 1 study. You can see there are no DLTs occurred at any dose. There were no SAEs in this study. There was 1 subject in each dose group with a treatment-related adverse event, and we'll look at that next. If you look here, all AEs deemed treatment-related by the investigator were ocular and likely injection procedure related. Other AEs were likely due to injection procedure itself, underlying disease progression, or concomitant diseases. There were no cases of endophthalmitis or intraocular inflammation. Patients were eligible to receive rescue treatment based on pre-specified rescue criteria. There was 1 subject in middle dose that received bevacizumab at month 2, and there were 2 subjects in the high dose group. 1 received aflibercept at month 1, and 1 received aflibercept at month 2. Here's the mean change in BCVA from day 0 for all treated subjects. One thing to keep in mind that this is accounted for rescue, and the value before rescue has been carried forward. What we see here is a rapid onset of action in mean BCVA was observed as of day 1 with 3.1 letters gain. The mean BCVA gain was the highest at month 1 with 9.2 letters. Mean BCVA gain was also maintained post-injection with a mean gain of 8.3 letters at month 3. Again, one thing to remember is this is after one single injection of THR-687. Looking at the mean change in BCVA from day 0 for all by doses, you can see that the most BCVA improvement was more pronounced in the high dose group with a mean BCVA gain of 12.5 letters at month 3. Again, this is after a single injection of THR-687. Looking at anatomy, overall marginal impact on mean CST was noted up to month 1, followed by a return to baseline level until month 3. Now let's look at the specific dose cohort, the mean change in CST from day 1. You can see there was a pronounced mean decrease in CST in the high dose group with a decrease of 106 microns at day 14. If you look at the high dose group, we want to see how patients are doing with visual acuity as well as CST. So this shows the high dose group, the change in BCVA from day 0 and CST from day 1. This includes the patients that were rescues and they're labeled with the R on it. And on the right, you see actually the specific patient labeled 1 to 6. You notice that there's a persistent and pronounced increase in BCVA in 3 subjects, that's subject 1, subject 4, and subject 5, with no need for rescue treatment. CST decrease was clinically relevant for 3 subjects, subject 4, subject 5, and subject 6, and was maintained up to at least month 2. These are the key takeaway messages from the phase 1 THR-687 study. THR-687 is safe and well tolerated. There were no DLTs and no SAEs seen during the study. It has a rapid onset of action resulting in significant BCVA gain and durability of mean BCVA. The high dose group, 2.5 milligram, had the most pronounced BCVA improvement and CST reduction. Further trials are needed to confirm the efficacy and safety of THR-687 in patients with diabetic macular edema.